Welcome to the Omnidental Podcast. We are diving deep today into something that I think is it's a huge psychological hurdle for anyone thinking about a major smile change.
hmm
The recovery time for dental veneers. You see those perfect after photos everywhere, but what about the reality of, say, those first 2 weeks?
The day-to-day experience.
Exactly. Are we talking serious pain or just a bit of discomfort? Our mission today is to cut right through the noise and give you the facts, a real playbook for the smoothest healing process.
And we're working from a great source for this. All of our insights today are pulled directly from the patient advice and protocols at Omnidental and MedSpa, which is led by Dr. Bylis Poles.
That's an important context.
It is, because they don't just do general dentistry. Their expertise is in advanced cosmetic and aesthetic treatments, so they're looking at the whole picture, which gives us a much clearer view of recovery.
And just for context, Omnidental is based in Arlington Heights, Illinois, and they serve a lot of the nearby communities, Buffalo Grove, Palatine, Mount Prospect, places like that. So with that said, let's get straight to the core fear. If you're researching veneers, you are worried about the downtime. How quickly can someone actually get back to their normal routine?
Okay, let's start with the benchmark, which is actually really good news. For the vast majority of patients, a full recovery from dental veneers takes about 2 weeks.
2 weeks.
About 2 weeks. And that means all the sensitivity is gone and the veneers just feel like your own natural teeth. That's the standard window we're looking at.
And what does recovery actually feel like during that time? Is it 2 weeks of hiding at home?
No, not at all. It's not a period of intense pain. What patients usually feel is some mild sensitivity or maybe a little discomfort.
Mostly to temperature.
Mostly to temperature, yes.
Yeah.
The procedure itself, it's done with local anesthesia, so you won't feel a thing during the placement. The sensitivity really only kicks in after the numbing wears off, and it's just a sign your teeth are adjusting.
2 weeks sounds incredibly fast, especially for a procedure that, it involves removing a bit of the natural tooth.
It does.
So is that estimate reliable for everyone? What if you have naturally sensitive teeth to begin with? What really determines if that timeline stretches out?
That's a crucial question. While 2 weeks is the average, there are 3 main variables that can either speed that up or slow it down.
Yeah.
The first one is the type of veneer material you choose. So porcelain versus composite. We're going to dive into that a lot deeper later.
Right.
Second is the baseline condition of your teeth. If you go in with healthy teeth and gums, recovery is almost always smoother.
And the third factor, I'm guessing that's the one you can actually control.
That's the one, precisely. It's your own oral hygiene and, how well you follow the diet restrictions right after the placement.
It sounds simple, but it's probably where people slip up.
Absolutely. If you don't protect that new bond or you expose the teeth to really hot or cold things in those first few days, you can definitely prolong that 2-week adjustment.
Okay, so to really understand those 2 weeks, we need to map out the journey. You said the preparation impacts sensitivity. Can you walk us through that 2-part process?
Of course. It's almost always a 2-appointment process. The first visit is the preparation appointment.
This is where the work happens.
This is where the work happens, and it's where that temporary vulnerability is created. To make sure the veneer sits flush and looks natural, the dentist removes a very, very thin layer of enamel.
The outer shell of the tooth.
Exactly, and that exposure is the root of the sensitivity. Underneath that enamel is the dentin, which has these tiny little tubules that lead to the nerve.
Oh, okay.
So when the enamel is reduced, the dentin is more exposed to, air and temperature. Now, you will almost certainly get temporary veneers at this stage to protect that surface while the permanent ones are being made.
So the biggest discomfort might actually be after that first prep appointment, before the final ones are on.
That's often the case, yes.
Yeah.
The sensitivity can be noticeable then. The second appointment is the placement appointment.
Simple enough.
That's where the permanent porcelain or composite veneers are bonded on with a really strong dental cement. Once they're on and fully bonded, they act as the new protective layer, and that's when the 2-week countdown really begins for the nerves to settle down.
Okay, let's talk management. We know some mild sensitivity is coming.
Mm-hmm.
What should you have ready at home to make those 2 weeks as comfortable as possible?
The goal is really pain prevention. So first, just standard over-the-counter anti-inflammatories, think ibuprofen. It's great for any general soreness after the anesthetic wears off.
And what about for that specific temperature sensitivity?
Desensitizing toothpaste is highly recommended. These toothpastes have compounds in them, often potassium nitrate, that help block those tiny tubules in the dentin.
Like a shield.
That's like an external shield, yeah. And a pro tip is to start using it a couple of weeks before your prep appointment if you already know you have sensitive teeth.
That's smart. That brings us to diet, which
Yeah.
has to be the most asked question. When can I actually eat something?
You can typically eat as soon as the numbness wears off, which is usually just a few hours.
But not just anything, I'm guessing.
Definitely not. This is where the strict rules come in. You absolutely must start with soft foods. Mashed potatoes, soups, smoothies, things that require almost no chewing force.
So for how long?
I tell patients, for the first 3 to 5 days, just pretend your new veneers are made of glass. You have to eliminate anything that puts pressure on that bond.
So no very hot, very cold, sticky, hard foods.
Nothing. No biting into an apple, no chewing on ice, no tough bread. The biggest risk here is either weakening the bond or just really aggravating that nerve sensitivity.
That's super helpful. It really grounds that 2-week timeline in specific actions. Now let's get into the material choice. You said porcelain versus composite really influences that initial recovery. How?
This is where we get into a really important trade-off. Porcelain veneers are, the gold standard for looks and how long they last.
They don't stain, right?
They resist stains beautifully and can last 10, 15 years, sometimes even longer. They're made in a lab and they're incredibly thin, but also rigid.
Yeah, because they're rigid.
Because they're rigid, the dentist has to remove a little bit more of the natural tooth structure during prep. It's necessary to create the space for the porcelain shell to sit perfectly without looking bulky.
And more prep means more sensitivity.
It's the reason porcelain typically results in a slightly higher degree of initial sensitivity. You're basically trading a little extra initial discomfort for what could be decades of durability.
Okay, so that's porcelain. A tougher prep, but a better long-term result. What about composite veneers? How are they different?
Composite is a totally different game. It's a tooth-colored resin that's applied directly to the tooth and sculpted by the dentist, often in a single visit.
So no lab involved.
No lab. And because it's so malleable, it requires minimal, sometimes even no removal of the underlying enamel.
Which would mean less sensitivity.
Exactly. This less invasive prep often translates to a marginally quicker and easier initial comfort period, but the compromise is longevity.
Right, they don't last as long.
They're much more prone to staining, and they typically only last 5 to 7 years. They can also chip more easily than porcelain.
That is a huge difference. What about repairs, though? If a composite veneer chips, is that an easier fix?
It is, and that's another critical difference. If a composite veneer chips, the dentist can often just patch it with new resin in one quick visit.
But with porcelain,
If a porcelain veneer breaks, you almost always have to get a whole new one made in a lab, so it's a more involved process. The takeaway is that you're balancing that initial short-term sensitivity against the long-term maintenance.
it has to align with your budget and your lifestyle, really.
It has to align perfectly.
This has been incredibly insightful. So to recap for everyone listening, the journey to fixing chipped or discolored teeth with veneers is very manageable. We're talking about a 2-week adjustment period.
That's the main thing to remember.
And to hit that 2-week goal, it really comes down to 2 things. First, do exactly what your dentist tells you about diet and hygiene.
Meticulously.
And second, use those desensitizing tools like special toothpaste right away. It's a very fast turnaround for a result that can last a decade or more.
Exactly. Veneers are such a powerful tool for a confident smile. And since the recovery time itself is short, 2 weeks is nothing in the grand scheme of things, the most crucial decision really is that material choice. Porcelain's durability versus composite's minimal invasion.
That's a great perspective to leave with you. If understanding the 2-week recovery is step 1 for getting those new, highly durable porcelain veneers, then what about step 2? What kind of rigorous long-term care routine, something more than just brushing and flossing, is necessary to make sure they actually last that decade plus?
A great question.
That's definitely something to mull over and maybe explore on your own.